that. But I can't really tell you until we've done that test, and so if you could get that done, we could do it in the surgery, and come back and see me a week after. Then we can maybe start your blood pressure tablets and tablets for cholesterol at the same time, save you coming back, on 2 occasions.
Okay.
Is that right?
Yeah. What are you say, doctor?
Yeah. I mean, do you smoke?
I smoke. Yes.
Do you?
Yeah.
Right. How many a day?
2. At times when I'm busy, about 10.
10 a day. That's quite a lot as well. You shouldn't really smoke. I mean, it's that's just another. I mean, that's not good for your heart either. So, I mean, I've got some information that I can give you about smoking. And do you want to give you some information about smoking? Or?
Shall I come back for that?
Yeah, I mean, I could give you a leaflet out at reception.
Okay, yeah.
If you want that.
All right, I'll take that.
And alcohol.
Alcohol, yeah, drink, yeah.
Yeah, how much do you drink?
Well, I mainly drink on weekends, and I go out weekends, yeah.
How much do you drink roughly?
A pint of beer, about 5 or so.
5 pints over the weekend?
Weekends, yeah.
Okay. Anything during the week?
I take bottles of wine, yeah, for the whole week really, after meals.
Right. How many?
Buy a glass or 2 of wine, after a meal.
Right. Okay.
Every day.
Right. Well, I mean that's probably a bit more than you ought to as well, especially if you've got all these other problems. So you really ought to cut that down. So you really ought to stop smoking. You really ought to cut your alcohol down.
Right.
And that'll help with your weight as well. So and then if you want to pick up the certificate, you can. So I'll have that ready for you afterwards.
Is that the notes?
The notes, yeah, that's right.
To the instructor, yeah, because I'm going to see him today.
Yeah.
Okay.
Yeah. I mean, does any of this run in your family? Does cholesterol problems?
No.
Yeah, blood pressure.
No.
Anyone suffered a heart attack or stroke early?
Not that I know.
In the 40s, anything like that?
No.
And you've never had pains in your chest or?
I do get pains now and again.
Do you?
Yeah, but not every day.
Yeah, what sort of pains do you get?
Pains just around there in my tummy.
Right. I mean, is it like an indigestion pain or what sort of pain is it?
I don't know. Just get pains now and again around here.
Okay.
But I don't think anything of it, really.
Right. Probably you ought to take some Gaviscon for that, and if it doesn't get better, then again we can discuss that. But I think it's really important we get on top of your blood pressure and cholesterol. So that's what I'd like you to do, and make sure you don't miss that appointment with the nurse.
All right.
And the nurse can also give you some advice about the smoking as well. So as I say, we'll get that set up for you as well. So if you want to come back and see the nurse.
When do I see the nurse?
Well, we'll get your blood test done and then get you booked in for the nurse to talk about smoking at the same time.
Oh, okay.
Come in. Hello there.
Hello there.
Hi, Mr. Khan.
Yes.
Hi, Dr. Mays.
Hello.
Come and have a seat.
Thank you.
How can I help today?
I'm getting this sort of dry cough, and I think it's the tablets.
Right. Okay. And from your screen, I think you're only on 1 tablet at the moment. Is that's the lisinopril? Is that right?
That's right. Yeah.
Okay. And that was started by one of my colleagues fairly recently, wasn't it?
Yeah. It's about I think about 6 weeks ago now.
Right.
Yeah.
Okay. And how long has the cough been going on for?
Well, pretty much since then, really.
Right. Okay. Are you coughing anything up with it?
No.
Okay. There's no blood or anything like that coming up.
Oh no, there's nothing like that. No phlegm, nothing whatsoever. It's just like a dry cough, you know.
And you're well in yourself with it. You're not feeling.
I feel fine. Yeah, I really feel fine. I've not had anything, so I can only really put it down to the tablets. Really, that's why.
No shortness of breath alongside the cough?
No, nothing like that, no.
Brilliant. Okay. Was there anything in the back of your mind that you were worried about particularly?
Not really, it's just really irritating, and it's just embarrassing really at work and everything. People have mentioned it,
Have they? What's your job?
I'm a bookkeeper.
Right. Okay. Are you managing all right at work, or are you?
I know I'm managing all right, but it's just embarrassing when you're on the phone or you're in an office with other people and you're coughing away all the time.
Sure.
People said, what you're doing about your cough, you should go and get it checked out, and
Okay. You're not having to take any time off or anything like that?
No. As I say, I feel fine in myself. It's just the cough that's been getting in the way, you know.
Yeah. Okay. Are you a smoker at all?
No, I
You're
don't
not.
smoke. No.
Brilliant. Okay. Do we start off perhaps by having a little look at you, have a listen to your chest and things,
Sure,
and then we'll sort of
sure.
take it from there.
Sure.
Do you mind perhaps popping your top things off and we'll have that?
No,
Is that
not at all.
right?
No, not at all.
And you were started on the lisinopril after you had some benefluconazole, didn't you, for your blood pressure?
I wrote that down for you.
Lovely, thank you. And that's because your blood pressure's been a bit high, I gather.
That's right. Yeah, I was diagnosed with that a few months ago now.
Right,
You know,
okay.
but it said like that one wasn't really doing much.
So you switched onto the lisinopril.
Yeah,
okay.
yeah.
Have a seat for me.
Okay.
Apart from the cough, are you feeling all right on the tablet? Apart from that,
Yeah, it's just a cough really.
okay.
Yeah.
Are you able to pop your shirt off for me?
Off me, no problem.
Lovely. Just have a seat again. That's great. Just have a quick look at your hands. Okay, take a big deep breath in for me. And out. That's fine. Just going to have a little listen to your chest.
Okay.
You could just keep breathing in and out through your mouth for
Sure.
me. That's fine. Just breathe away normally. Just going to have a quick listen to your
Okay.
heart. Okay, just have a quick listen on your back as well there. If you could have a few more deep breaths in and out.
Sure.
Indeed. And last one. Stay with you on for a second. That's fine. Whilst you've got your shirt off, I'll just take your blood pressure as well. Who's at home with you at the moment?
I live alone.
Okay.
Yeah.
So you're not keeping anyone awake with your cough?
No, only myself sometimes, but.
Just do pop your shirt back on again. Your blood pressure's definitely a bit better today. Anyway, it's 145 over 92.
Right.
Don't know if that means anything to you.
Not really, to be quite honest.
The last few times it's been done, it's been quite high.
Right.
So certainly looks like the lisinopril has helped your blood pressure, although obviously it's not doing a lot for you in terms of the fact that it's making you cough.
Yeah.
I can't hear anything in your chest. That all seems completely normal. And if
Okay.
you're otherwise well with it, it seems.
Yeah, I do. I feel fine. So I've not had any time off work or anything like that.
Mm.
It's just really irritating. It's just embarrassing, really.
Yeah.
You know, people mentioning it.
Had you had any thoughts about what you wanted us to do today?
Well, I just wondered what I can do about the cough. Really, I thought maybe I should stop taking them, but I thought I'd better not do that without sort of discussing it with you. You know,
brilliant.
or maybe just have a rest for a couple of weeks, let it all sort of wash out.
I mean, there's a couple of ways we could approach it, really.
it's a shame in a way because obviously it's doing something good for your blood pressure, but there are other blood pressure tablets that we can use. So depending on how much it's bothering you, we can either sort of wait and see whether you the cough settles down at all, or whether you sort of learn to live with it, or
I mean, that's the main reason I came in, because of the cough, you see, because when I was prescribed that, it had come back in a couple of months, but I've been trying to hang on, and I thought, you know what, I can't wait another few weeks to come back to see about this cough, because it's really starting to get in the way, and it's kept me up a few times at night as well, it doesn't seem to be easing at all.
Yeah. Would you rather go along the line of perhaps switching to another drug then?
If you think there are other ones that, because I don't want to be on this and have the cough all the time,
Sure. I mean, as I say, there are lots of different types of drugs that we can use. There is another type of drug which we commonly switch people to from the type that you're on, because cough is the commonest side effect that people tend to get with that kind of dry cough is quite a common side effect. So we could perhaps switch you over to that sort and see how you get on with that, if that's the way you'd like to play it.
Well, as I say, the cough, that's why I came in, because I just thought I can't keep coughing like that. It's starting to cause me, problems.
Fine.
And things. So.
Well, shall we do that then? If we say that we'll stop the one that you're on, and then I'll do your prescription for one of these other kind. I'll start you on one perhaps called losartan, and again we'll sort of start with a lower dose and see how we get on with that, because we'd need to keep an eye on your blood pressure, whatever you're on. So if we start you on some losartan, I'll give you a prescription today, and then perhaps if we see you back in about a month or so, just to make sure you're getting on okay with the tablets, and check your blood pressure again.
Right, okay.
Does that sound reasonable?
That's fine. So how long should I give it before I sort of, I mean, you said a month to come back.
Yeah.
How long should I kind of give it before I feel that they're working and stuff, any side effects, things like that, that's what I'm saying.
Okay. Well, I mean, I think probably after a few weeks, if you haven't had any side effects, I would expect the side effects of the lisinopril to hopefully go away fairly soon, once you stop taking them. But if you're going to get any side effects from the new one,
that's what I meant. The new one had things.
Yeah, I mean, as you found with the lisinopril, any side effects will probably come along fairly early on. That's the commonest thing, that if you're going to react to a tablet, you react to it fairly early. So hopefully, by a month you'll have settled into it okay. But obviously, if you have any problems before that, then the door's always open. You're more than welcome to come in sooner if needs be.
If I feel something's not right, it's right, just come back.
Absolutely.
All right.
That's fine. So if we do your prescription, perhaps for some. It's Hardy-Calm, isn't it?
Yeah.
What's your date of birth?
19th of the 4th, 58.
Okay, so there's a prescription for you. Just pop down to the chemist with that and do a direct.
Hello, Alison.
Hi.
My name's Daphne Hazel, one of the GPs. How can I help?
Right, it's my neck. It's killing me. It started off aching yesterday, but I can hardly move it today.
Right, and did anything start it, trigger it
I can't
off?
think of anything that would have triggered it off, but it's absolutely killing me.
And have you had anything like this before?
No.
No. And you weren't doing anything sporty?
No,
or went to the
nothing
gym
at
or-
all. I've just been working.
Right. And what do you do for a job?
I'm a teacher. I'm actually on half term at the moment, but I've only got about 2 or 3 days left, and I really, really need to get it sorted. So I can't afford to take any time off.
No, okay, I can understand that. And is work going all right? Is there...
Yeah, it's good.
It's good, okay. Any, have you had any injuries recently?
No, not at all.
Any car crash,
No.
accidents? Or...
No, not at all, but I do ride a motorcycle, and I'm finding it really, really hard to sort of look behind me and get my helmet on and off.
Right.
I'm just a bit worried because it's my only way to get to work.
Have you been driving today, or?
No, not
You haven't
today.
been able to?
No, I haven't been able to at all.
Okay. And any other symptoms with the aching?
No, I mean, everything else
tingling in your
feels fine.
fingers?
Everything else is fine. It's just sort of from here up and more on the right-hand side.
Right. So the left's fine, it's just...
Yeah, I mean, it hurts a bit to turn around, but it's just much more this side.
Okay. And any headaches at all?
No,
No problems in your arms, no weakness,
No,
no
not
funny
at all.
sensations?
no,
No. Okay. Do you have any other medical problems?
nothing.
No. Fitting well?
Yeah.
Okay. But if I have a feel of your neck, and I'll sort of see what I think it might be, and then we can talk about what we do from there. Is that
Okay.
right?
Mhm.
If you slip
Do you
your
want me to
cardigan
take
on,
this off?
yeah, if you can. That's it. You can just leave that one hanging down.
Okay.
That's fine. Do you want to show me where it's sore?
Yeah, it's just more all around here.
Okay. All up this
Shoulder.
muscle here, is it?
Yeah.
Okay. Just let me know if it hurts when I press.
Yeah, that really hurts.
Okay. And up here as well?
Yeah.
Okay. And is it up here or is it stop?
It's not so much up there, it's just all...
It's all down here?
Yeah.
Okay. And just feel the other side to compare. And do you feel otherwise well?
Yeah, I do.
Just this shoulder worrying?
It's just really worrying me about getting back to work.
Yeah. Is that tender at all there,
And
Alison?
it's not so much there, no.
No, it's just here?
Yeah.
Okay. And are you able to move your arms all
My
right?
arm's fine, yeah.
Okay. Let's just see if we can... If you copy me with your head, can you put your chin right down? Yeah.
Yeah, it does ache.
Look
But
over that way towards the computer. And then that way towards the wall.
God, it's really hurting.
Okay. There, you can put your cardigan back on. Well, it does look like it's not anything serious. It is just a muscle injury, although it's very painful, obviously.
Right, okay.
And I think it'd be good if we could give you some painkillers just to
Right, there
ease
is
it off.
something that I came in for in particular. I've got a friend who's a drugs rep and she's recommended Supercoxib.
Oh, right. I have heard of it. It's a new drug.
It's supposed to be the best and she
Right.
said it would definitely clear it up in a few days.
Okay, it's not normally given for muscle ache. I don't think it's proven to be any better than the painkillers I was going to
She
suggest you
definitely
take.
said it was the best.
Okay. Well, how about if have you taken anything at all? so
No,
far?
I haven't taken anything yet.
Okay. Well, if we started with something like 2 drugs using paracetamol and ibuprofen together, because together they're quite powerful, and see how that went, and then think about using other stronger drugs a bit, sort of a
Right,
bit
but the only
further
thing is
down
though,
the
if that
line.
goes on and then I'm back next week, I really can't afford to take any time off work.
Yeah.
So
I
no way you can
understand
give me
that.
that just so I know it's going to be cleared up and...
No, there's not much evidence that the drug I've got written here, it's not really prescribed for muscle ache. It's any better than using ibuprofen and paracetamol. That's definitely sort of second line, like something that we try. Your friend, I don't know what she would say, but people generally use it as a second